started now. Just a reminder, we have approximately 30 minutes and one question, one follow-up. Today we have Dr. Yaffe and Dr. Huyer here, so I'll turn it over to them to get started.
Thanks very much. Good afternoon, everyone. I am pleased to be joined today by Dr. Dirk Huyer, who is the COVID-19 Vaccine Distribution Task Force member and coordinator of the provincial outbreak response, as well as Ontario's chief coroner, a busy man. I will first provide an update on our most recent data and provide some general comments, and then offer Dr. Huyer the opportunity to provide any additional remarks if desired. So since our last update on Monday, Ontario has reported an additional 9,156 cases of COVID-19. If you break it down, that was 2,791 cases on Tuesday, 2,941 on Wednesday, and after those 2 days that were below 3,000, today we're reporting 3,424 cases. Ontario's current 7-day average for daily COVID-19 cases is 3,369, which is down from 3,810 last week and 4,176 2 weeks ago. When we look at the 7-day case rate per 100,000 population, the provincial number has been decreased by 15%. However, it is still high at 165.8 cases per 100,000 population. The number of patients in hospital and ICU remains high, with 1,964 people currently in hospital and 877 of them in ICU. And sadly, since our last update, we are reporting another 95 people in Ontario who have died from COVID-19. As always, our condolences and our thoughts are with those who are mourning the loss of a loved one in these very difficult times. In terms of testing, 54,118 tests have been processed yesterday with a positivity rate of 6.8%. The current 7-day average for percent positivity is 7.9%. There are now 84,731 cases that are confirmed variants of concern in Ontario. The majority of these are still the B117 variant, which was first identified in the United Kingdom, although we are seeing increasing numbers of the B1351, or South African, and the P1, or Brazilian variants. The 7-day rolling average positivity for variants of concern is remaining fairly stable and is currently 74.1%, which is slightly down from last week. Although today's numbers are up compared to the previous 2 days, we are seeing some early signs of improvement. The public health measures are having some effect, as is the continued vaccination rollout. To date, more than 5.7 million doses of COVID-19 vaccine have been administered in Ontario, and this includes 141,038 yesterday alone. And beginning today, the province has expanded booking eligibility for COVID vaccine appointments to individuals aged 50 and over, individuals with high-risk health conditions, certain people who cannot work from home, and in addition to the other channels previously available to book their appointments to First Nations, Inuit, and Métis individuals. Appointments can be booked through the provincial booking system and booking online, or directly through local public health units through their own booking systems. The province is also expanding the use of the Moderna vaccine to the pharmacy channel this week and launching mobile vaccine units for small to medium-sized businesses in hotspot communities. What this means is that more and more Ontarians will be getting immunized, and every time somebody gets immunized, it makes us all a little safer. So I continue to encourage all Ontarians to get vaccinated as soon as you are eligible. And as we seek to get as many people vaccinated as quickly and safely as possible, it's important to continue to stay at home and reduce your mobility as much as you can. While we have seen some improvement, it wasn't very long ago that we were seeing daily numbers in the 4,000s. And while we are seeing some reduction in the number of people in hospital and ICU, those numbers are still far too high. Thinking about those individuals who have lost their lives and about those receiving treatment in hospital, some of whom are gravely ill, should compel and motivate us to do all we can to stop the spread of COVID-19. If Ontario is to end our third pandemic wave and avoid a fourth wave, we must continue to drive transmission down. This will require our continued commitment to those public health measures that we know work. So yes, this means that if you don't live with your mother, I'm sitting here once again asking Ontarians to celebrate Mother's Day virtually this weekend. The virus is still spreading. We know how it spreads from person to person, which is why we have been so focused on asking everybody to limit the number of contacts that you have. The fewer people you have contact with, the lower the risk of exposure to COVID-19. Ontario traditionally has observed a rise in COVID-19 cases after special holidays. And at a time when we are only just starting to see an improvement in trends, we cannot afford to put that in jeopardy. We will get through this. So thank you for your continued efforts. And with that, I will turn it over to the media unless Dr. Huyer has some comments.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Colin DeMello with CTV News. Please go ahead.
Hi, good afternoon. I just wanted to ask Dr. Huyer about a comment that was made today by one of the government ministers. They were citing a study out of Qatar that talked about Pfizer and the first dose and about how effective Pfizer is against the UK variant specifically of the virus. I believe the study had said that it was 30% effective after the first dose and up to 95% effective after the second dose. This was something that the minister said, though, today. I'm wondering what your thoughts are about that comment, about whether it creates some kind of worry about the effectiveness of the Pfizer vaccine.
Hey, Colin, thanks very much for that question. And obviously I wasn't there, but I do know the study. It is a study, but it was published in the New England Journal of Medicine. And what they looked at is people who were infected after, so PCR positive after one dose. But what they don't talk about is the period of time after the first dose. And we in Ontario have looked carefully at this as well, not so much myself, but other experts and scientists. And there's been 2 evaluations of infection after vaccination that just have been talked about most recently. And I can tell you in the one that looked at infections after the first dose, within the first 14 days, we did see a significant number of people so within the 14 days after the first dose, that's where the majority of infections were observed. And as we moved away from the 14 days, the number of infections decreased over the period of time between the 14 and 28 days. Looking at the vaccine effectiveness of dose 1 in our population for the period of time for December 14th and April 19th, we did see an effectiveness of 70% of a vaccine effectiveness, which showed people were not positive within that period of time, extending up to 42 to 48 days. So the I don't know the study in any greater detail, but when I looked at the study, they didn't specifically give the time frame after the first dose. And we know that protection doesn't begin, or what we've experienced doesn't begin till about 14 days. And some of the newer information is suggesting it may be even longer after the 14 days. And clearly good response after the second dose as well for both vaccines. So that's the perspectives that I can provide, Colin, on the observations. And within that period of time, as you know, we have had cases of P1 and we have had cases of B1351 during that period of time. So that's our observations in Ontario right now.
If I could just add to that, thanks. In follow-up to Dr. Huyer's comments, which are completely correct, the vaccine effectiveness that he was talking about, around 70% after the first dose, was for preventing infection. When you look at preventing severe infection, as in people who end up in hospital, ICU, death, even after first dose, we have found the vaccine effectiveness to be about 90%. So, we know that it takes time to respond to the vaccine, as he said. Up to 14 days, potentially longer, particularly in older people. But even after one dose, the experience in Ontario has been very good.
That's why we're a team. Thanks. I talked about what I gave the numbers were symptomatic infection, and then Dr. Yaffe's talked about the severe outcome of hospitalization and death.
Follow up?
I appreciate that. And so the government was kind of raising this 30% figure as a concern. This might obviously cause some concern among a lot of people in this province who are only getting their first dose and having to wait until 4 months to get their second dose, apart from what Pfizer has recommended or what they've tested the vaccine for. So what level of confidence do you guys have in the effectiveness of the Pfizer vaccine after the first dose in preventing severe illness, death, or just, even being a safeguard against the UK variant in particular?
Against the UK variant, there's good evidence from the clinical information, but also the actual real-world evidence. There's good evidence in other countries, in a number of different countries, and our evidence, as described, is very good. So we have seen significant protection from the first dose based upon data that we saw as recently as today and over earlier this week. And we've also seen that demonstrated quite well through the population of the numbers of severe infections and hospitalizations and deaths dramatically decreased in the older population, and hoping to see similar as we continue to vaccinate through the different age groups. So we have significant good information that supports both reduction in infections, but also significant reduction in severe outcome, hospitalization, and death. 91%, as Dr. Yaffe pointed out, after the first dose.
Next question.
Your next question comes from Stella Duprise with Radio Canada. Please go ahead.
So, hello, do you hear me?
Yes.
Perfect. So my question is, yesterday, Health Canada approved the Pfizer vaccine for children ages 12 and up. Alberta and Quebec announced that they will offer the vaccine to this age group starting Monday in Alberta. Will children ages 12 to 15 be able to get vaccinated in Ontario, and when?
Thank you for that. Yeah, we're really thrilled by that Health Canada announcement, because clearly want to get the vaccine as broadly as we can across the population. Right now, we have a plan, and children and adolescents were considered within the plan, and they were in our three-phase approach to vaccination. They were included in phase 3. We focused on age and at risk throughout the phase 1, 2, and 3 plan, and right now you've seen likely the plan that we have. Today we have opened up to to a lower age band, 50 and plus, and looking at specific risks, we've opened up availability and eligibility to those who are at risk because of high-risk health conditions, as well as those who are in the first group of not being able to work at home, who are placed into an exposure risk, and also lower age groups within those communities which are at greater risk. So we are focusing and continuing our plan of age at risk, and the children and adolescents, we will actively develop a plan to be able to ensure that they fit in as the risk areas, and those who are at greatest risk of severe illness and death are provided the opportunity for their first dose, and then children and adolescents will follow within that period of time.
Follow-up?
So do you have any more details? At when can we expect that? Is it June, July? And do you have any more details about the end of the school year? Is it going to be, are children going to be able to get back to school?
So a couple questions there. As you know, likely from our plan, we are opening to age 18 and plus across, so anyone over 18 plus in the week of May 24th. That's aligned with the supply that we have, and that's aligned with the plan that we have in place. So it will be after the week of May 24th, likely, based upon our current planning as of today, but we are actively discussing and thinking about how will we approach the 12 to 18-year-old, specifically the 12 to 16 that just had additional approval. So I can't specifically tell you when that will occur. I don't know if Dr. Yaffe wants to comment on when will schools, if schools will open or not.
Yes, thank you. Thank you for that question. We are very actively working with the Ministry of Education and with local public health units to look at the statistics. How many cases are there? What's the transmission? What is the capacity of the hospitals locally? And what is the R effective in terms of transmission? All those various factors will go into a decision around when schools can open, keeping in mind that schools would be the first to open among all the things, because that is the most important really aspect, and last to close. So it's definitely being discussed. I can't tell you exactly when, but we want to be careful. We don't want to open too soon and then close immediately after. But on the other hand, we're very cognizant of the severe negative impacts that closure of in-class teaching is having on children. So it's very much an item of monitoring and discussion.
Next question.
Your next question comes from Randy Rath with CHCH TV.
Yeah, hi, doctors. Thanks for taking my question. Dr. Huyer, a couple of weeks ago, you said that during the third wave, you saw a very concerning trend in people being sick but not sick enough to go into the hospital and then dying quickly at home. Are we still seeing that? And if so, do you have any statistics on it?
Yeah, thanks, Randy. I hope you're doing well. So what we saw during the month of April were 29 people in the south central area of Ontario. And since over the days in May, we have seen 7 more people tragically die in similar circumstances at home, and are in the process of being investigated by our office.
Follow-up?
Okay, thank you. Hamilton today has a positivity rate of 12.3%. That seems high compared to the rest of the province. Have you guys had any discussions with the Chief Medical Officer of Health in Hamilton, the Regional Medical Officer of Health? And is there anything that can be done to try and bring that number down?
I will start. I guess we'd have to look at the numbers. I haven't spoken to her, but I certainly can follow up. I don't know how many people were tested. So, sometimes the percent positivity goes up relative to, because the number of people tested has gone down. So we need to look at that. Are people getting tested that should be getting tested? Where is the positivity? Are there outbreaks happening that need to be looked at? And there are certainly outbreaks still happening across the province. I'm not sure about Hamilton specifically. I do know that the majority of new outbreaks tend to be in workplaces now. So We can certainly follow up with the medical officer of health for Hamilton. I'm not aware of any specific situation there at this point.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star.
Hello, doctors. I just want to look ahead to 2 weeks when the current stay-at-home order is supposed to expire. I know a lot of doctors have warned about a false sense of confidence and our case numbers and ICU is so very high. But what do you want to signal to people about what to expect 2 weeks from now? We're starting to see restaurants pushing to open, which it sure doesn't look to me like is going to happen. So what should people expect going into the latter half of May and into June in terms of the kind of restrictions they're going to continue to face?
Well, of course, there are active discussions around what to do in terms of what the numbers, what are the thresholds that should be considered for any loosening of restrictions. We don't know yet, of course, but I would say that given the number of cases is so high still, the number of hospitalizations and ICU overload and so on, I would be surprised if things open up at the end of May. They may open partially. Certainly, we don't want to open prematurely and end up with a fourth wave. That is the last thing we need. I think people should remember to follow public health measures, even if you've been vaccinated. And of course, if you haven't been vaccinated and you're eligible, get vaccinated. And remember that it's safer to be outdoors for activity than indoors if you're going to be with other people. We have the 2 out of 3 rule: outdoors, physical distancing of 2 meters, masking. So if you fit at least 2 of those 3, now that the weather's getting better, get out, exercise, and, do what you can to maintain your own health. And we'll see as things progress, hopefully the numbers will get better.
Rob, it's good to have another day with you. But I think it's such an important question, and it would be really great if we had that answer. But what I can say is today is 2 weeks before 2 weeks from now, obviously. And the key point is what we're doing today will help us to know what will happen in 2 weeks from now. We have 44.3, now it's higher than that today, of those over 18 who have been vaccinated. We have a vaccination plan that's tracking to have 65% of the population above age 18 having received their first dose by the end of May. These will have significant impacts. Other activities as of today will, as I say, have impacts for 2 weeks from now. So everything that we can do to continue to take all of the precautions and take all of the steps that we can to reduce any transmission will reduce those numbers and really impact what we will see in 2 weeks from a number point of view, from a hospitalization point of view, an intensive care perspective, and also deaths of those who are loved by many. So I really think the importance of focusing on now to think about what will happen and impacting 2 weeks from now.
Follow up.
Thank you for that, both of you. And just I wanted to talk a little bit about into the summer. As Dr. Huyer was just saying, the vaccine will have significant impacts. I think just anecdotally talking to people, they are worried that cases are so high now that we are not going to be in as good a shape this summer as we were last summer because there's so many people in the ICU now, and it's going to take a long time for that to come down. So I know no one really has a crystal ball, but what's your gut feeling for how the summer is going to look?
You're right. We don't have a crystal ball. And I like what Dr. Huyer said about focusing on the now and what you can do now to prevent transmission. I do think it's important to keep in mind that the number of people in the ICU is a late indicator. So when you become infected, it takes a while till obviously till you become symptomatic, and then it takes days till you become really ill. You end up in hospital, ICU, and so on. So, and once you're in the ICU or in the hospital, depending on obviously your what's going on with your health status, you may be there for a while. So there will be a delay in seeing the number of people in ICU go down, even when the number of cases start to go down. So, and of course, that's one of the indicators we look at is the health system capacity. What can I say for the summer? I think what I said before. Focus on getting yourself vaccinated, focus on following public health measures, and think about the outdoors as being safer than the indoors. And we're very carefully monitoring the numbers and getting the vaccine out. And now we have the good news about the children, 12 to 17, being able to get vaccinated. So we'll just keep going, and hopefully we'll have as good a summer as possible.
Last question.
Your final question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Oh, hi. Thanks. Yeah, I just wanted to go back to Colin's question about the efficacy of the Pfizer vaccine. Dr. Huyer was saying, that the data that we're relying on shows a 70% number. Is it a problem that a cabinet minister is waving around a study that has a much lower number, a study that doesn't, even its own authors say, doesn't say what he says it says, and causing doubt about whether the Pfizer vaccine actually works against the UK variant well?
Well, I'll jump into that by saying I can't speak to what the cabinet minister was thinking about. Clearly, he had a perspective that was important to share. What I can say is looking at the study, providing my interpretation and my analysis of the study, and also provide the Ontario data. I can't speak to what the cabinet minister was saying. I suspect that he likely had a message that came out in a way that was interpreted differently than I'm interpreting the study.
And just to switch gears, I guess, to what we can expect in the coming weeks. I know you talked a little bit about it. We don't have a crystal ball, but if things do continue on this trend, and we're 2 weeks or 3 weeks away from now, one of you had mentioned the possibility of some sort of opening, schools. Would there be a possible relaxing of outdoor activity rules at first? That kind of thing would be a gradual change we'd see?
It's very hard to say what exactly will happen. I know there's a lot of things being discussed, but I do know that whatever is planned hopefully will be done very gradually and slowly. We don't want to open up and then close again. We don't want a wave 4. So we need to, and schools obviously are very important. If we're going to open, to my mind, they are the first thing that should open. And that's really all I can say at this point.
Thanks, everyone.